You mentioned 19,000 cases in the last 24 hours, which really shows the scale of the impacts of this very transmissible Omicron variant. Now, I realise you don't actually run the booster programme, but your strategic coordination group was very effective in the first waves of the pandemic in making sure that things worked in London across every borough. So wherever anyone lived in London, they were looked after. They got a similar experience. And I just wonder what role the Strategic Coordination Group is playing in coordinating this latest response so that whichever borough you live in, Londoners are able to book a booster, get a PCR test, get hold of lateral flow kits if they need them.
Well, firstly, Chair, can I thank the member for her comments. I'm meeting with the leaders later on today. They'll appreciate those comments because they're tired, they're fatigued, and that recognition is much appreciated. So we've been working all this week, as I said, but also previously, we've accelerated the work we're doing. And you'll see some of the fruits of that, Caroline, this weekend in relation to, you may have heard in yesterday's press conference, reference to Wembley Stadium, Stamford Bridge. We'll also have another stadium in London stepping up, offering their services. But one of the big things we're trying to do using our contacts is get people to take advantage of what's called the Evergreen offer. There are still, roughly speaking, 1.3 million Londoners who've not even had one vaccine. And so we're going back again and again. And there's some good news, which is over the last week, we've had record numbers of people taking the vaccine for the first time. We've gotten, as far as the country's concerned, in relation to those taking the first vaccine, we're doing incredibly well, but there's still many people we haven't yet reached. As far as the booster jab's concerned, the good news is we're giving, roughly speaking, 8,000 a day. We've given 2.4 million, but it still leaves 2.8 million Londoners who are eligible for a booster jab because their second vaccine was more than 3 months ago, and those are the ones we've got to reach, as well as those who've not even had one vaccine. And we're using all the contacts at our disposal, faith leaders, trade unionists, volunteers, sports stadium, shopping centres and so forth, and any help you can give, because obviously you've got reach in some parts of the community, others don't. Please, encourage people to have the booster jab and the vaccine.
No, absolutely, and getting as many Londoners to feel confident to take up their vaccine is incredibly important. Now, the boosters, though, aren't the whole picture, because once you've had your booster, I had mine last weekend, but it's not going to kick in for another couple of weeks in terms of protecting me. So just in terms of measures to prevent spread of the virus and to keep everyone safe. Obviously, you've got a role in public health messaging around mask wearing on the tube, on buses, and you've been doing a lot on that. But we know that coronavirus is airborne. We know we need to be in well-ventilated spaces, and we know we need to be very mindful of mixing with people indoors. So will you widen your public health messaging on TfL to include the importance of keeping the windows open on buses and trains where that's possible? And I know you've done some fixes on buses to make that work, but this is a question about the messaging.
Chair, I'm more than happy to look into the messaging to see if we can improve that. And those sorts of ideas are really welcome. I mean, just to remind colleagues, Senator Russell knows this, but it was because of the ideas we received last summer that the windows now permanently open, clear issues with temperature. But I think people prefer to be a bit cold and with good ventilation rather than alternative, including the windows in between tube cabins also open as well. But again, I'll see what else we need to do to amplify messaging.
Thank you very much. I've also been in touch with London Underground staff who are worried about their health. They're working on the front line. They're being exposed sometimes to verbal abuse and even spitting incidents, and they feel like they're between a rock and a hard place. Are you able? What are you able to do to protect those TfL workers who are on the front line? They're not enforcement officers. Is there anything extra you can do to just or even use your voice to encourage Londoners to treat these frontline workers with respect?
Well, firstly, this gives me the opportunity to put on record our thoughts at this time of year to the 103 families of transport workers who've lost their lives since this pandemic begun. It is unacceptable for anybody to be at the receiving end of verbal abuse, let alone physical abuse. Too many of our transport staff are on the receiving end of verbal abuse and physical abuse. One of the reasons why we don't encourage, inverted commas, normal TfL staff to enforce face mask wearing is because they then receive verbal abuse. That's why only the enforcement officers do so. They've issued, I think, 800 fixed penalty notices. But I'm quite clear that there is no place in a civilised society for abuse to those doing their job.
Indeed. Now, my final question is about the safety of meetings like this. Do you agree that the government urgently needs to bring back legislation so that formal assembly meetings, formal council meetings across this city can be held virtually, legally, because this meeting has to happen in person without government legislation to make it possible to hold it virtually, so that particularly our staff and also members and you can stay safe while we're doing our work?
Can I raise this really important and profound point, which is I worry the Prime Minister is risking public safety and public health because he's worried about upsetting his backbenchers. We know, I'm afraid, to do so would require a vote in Parliament, and because the Prime Minister hasn't got the support of his party, he's scared to take it to Parliament, which means we're risking our personal safety by attending in person. It's a mockery of what Chris Whitty said yesterday and a mockery of the public health advice.
I'm out of time, but thank you very much.